The level of COVID-19 is on the rise again as a new variant emerges in the U.S. Here to explain is Dr. Daniel Kritzkis, Chief of Infectious Diseases at the Brigham. Dr. Kritzkis, great to see you. Not great to be talking about this again.
No.
Yeah, I wish we weren't talking about it again, but good to see you, Ben and Erica.
All right, Dr. Kritzkis, this new variant, it's called EG5. That's kind of refreshing. We're adding some new letters to the alphabet soup. I don't know if that's a good thing. A couple of questions here. Is this part of Omicron? And if so, whatever happened to all those other Omicron variants, XBB1 point whatever, and how is this different?
Yeah, so EG5 is still considered part of the Omicron family. There were probably a dozen or more different XBB subvariants, and now EG5 is beginning to peak up. It's about 17% of all cases, so it's the most common, but not nearly a majority of the variants yet.
Okay, what makes it so different?
Well, its sequence is different. The genetic sequence of this particular virus and its spike protein are different enough that it merits giving its own set of letters.
All right, as you know, the level of COVID in local wastewater has been rising slightly. It's still very low, but the same is true for the number of hospitalizations in our area. So do you think EG5 might be to blame?
I think it's a little early to blame it on EG5. Again, if it's only making up about 15 or 17% of cases, then most of the cases that we're seeing are from all these other variants. And it's important to keep things in perspective. Yes, there has been a bump, and it could go much higher. We can never predict. But right now, it's still a very small bump. It's maybe, we have 7 people in the hospital today who have COVID and 2 in the ICU. So that's not a much of an increase compared to where we were last week.
Okay, so we're still waiting for the CDC to decide whether to offer an updated booster shot this fall. Could the rise of EG5 or even just, more occurrences of COVID in general affect the timing or even the formula for the shot?
Yeah, that's a really tough question because a lot of resources have been committed to making a booster based on XBB. And we knew that was a bit of a crapshoot because the variant could always change between the time the vaccine is manufactured and the time it's deployed. I think the reassuring thing is that people's immunity will be boosted. They will get good protection from a booster against severe disease, regardless of which particular Omicron variant ends up being in the circulating around at the time that people get boosted, but they may not get full protection from infection. It's always impossible to predict the future here.
All right, Dr. Daniel Kritzkis with the Brigham. Thanks so much for your time and expertise. We appreciate it.
You're very welcome.
Yeah,